Chinese COVID-19 vaccines are being used in dozens of countries.
China has donated vaccines everywhere for those countries who need help.
But these shots have some of the lowest efficacy rates among globally used coronavirus vaccines, ranging between 50 to nearly 80%. Compare this with shots from Pfizer-BioNTech, Moderna, and Russia's Sputnik V. The head of China's CDC in early April said the efficacy of some vaccines was not high, and this also included ones from his own country. So China is looking to bolster the protection rate, and one way is to mix and match different types of vaccines. And this idea isn't new.
We really welcome studies that would look at mix and match regimens.
Spain is also interested in combining vaccines, while researchers in the UK and Russia are already studying this. So as China joins the ranks of countries looking to mix and match, here's how it can be a key to overcoming multiple vaccination challenges at once. Most Chinese vaccines and other shots currently in use require 2 doses, creating an opportunity to mix and match. Some immunologists believe this could have a number of benefits, like boosting the immune response.
The theory is that if you train the immune system to recognize a virus in a slightly different way each time, then you might get a broader and more durable immune response.
And a more robust immune response is important since China has confirmed cases of new and more transmissible variants that were first identified in the UK and South Africa. Mixing and matching for this reason has gotten support from at least one Chinese drug maker so far. Some immunologists also say that mixing and matching could ease the pressure from the vaccine supply chain. So for example, in countries that are rolling out Chinese vaccines along with other supplies, using 2 different shots could give doctors more options when patients come in for the second dose. But one of the most important reasons is when there are severe side effects from one of the vaccines.
If someone perhaps has a strange or severe allergic reaction to the first shot that they get, perhaps then you could avoid that by giving them the second dose from a different vaccine.
The idea became particularly important after regulators started investigating rare blood clotting disorders linked to AstraZeneca's COVID vaccine. As of late March, 79 people in the UK have had severe blood clots out of the 20 million administered doses of AstraZeneca's vaccine. In France and Germany, health authorities are advising younger people who have received a first dose of AstraZeneca to get a second dose of a different vaccine. The drug maker said it's working with health regulators and studying the rare blood clotting events and possible causes. While these upsides could bring China and other countries closer to getting their population vaccinated, health authorities say there's still a lot to learn about possible side effects or how it may affect efficacy of the vaccines, especially when it comes to combining shots made with different technologies.
Vaccines such as the Chinese vaccine and the vaccines by AstraZeneca and Johnson & Johnson are vaccines that use a virus as the vector to get the genetic instructions into your body.
Whereas Pfizer-BioNTech and Moderna vaccines use a new gene-based technology involving messenger RNA, where molecules carry genetic instructions.
So we're not too sure what happens when you mix these 2 technologies together.
Chinese health authorities have said people can receive different brands that use the same technology, but don't recommend mixing vaccines with different technology so far. But now, trials with the combination of 2 homegrown vaccines with different technologies are underway in China with more than 100 volunteers. The country is also working on its own mRNA vaccine and looking closely at approving Pfizer-BioNTech's shot, according to people familiar with the matter. This would pave the way for China to mix and match its more conventional vaccines with mRNA shots, similar to how researchers in the UK are studying the combination of AstraZeneca with Pfizer-BioNTech or Moderna. Those results are expected as early as May.
Immunologists, when you speak to them about this sort of process, are pretty enthusiastic about it and optimistic that it's going to work. But that's maybe the one big drawback, is we want to make sure that it works. We want to make sure that it isn't worse. You don't get a worse immune response than if you had 2 doses of the same vaccine.